Thank you very much, Mr. Chairman. And I share your view that this opioid issue is another one where this committee can come together and work in a bipartisan way, and I look forward to working with you in that regard. As the committee that is required to pay for the most important health programs in the nation, the Finance Committee must step up and do its part to address the opioid crisis. In the coming years, Medicare and Medicaid are expected to account for over a third of substance abuse-related spending. That amounts to billions and billions of dollars each year. Any solution that is going to stem this tide has to include the Finance Committee and our bedrock health care programs. Americans today are paying for a distorted set of priorities. Americans are getting hooked on opioids, there's not enough treatment, and enforcement is falling short. That sounds like a trifecta of misplaced priorities to me, and the Finance Committee has the opportunity, working in a bipartisan way, to develop fresh policies to start righting the ship. As one listens to the current debate on opioids, there is a sense that somehow policymakers have got to line up and choose one of two solutions. One approach is tough enforcement, which means cracking down on pill mills, fraudsters bilking Medicare and Medicaid with unneeded prescriptions, and unscrupulous abusers doctor shopping for the next bottles of pills. Others want to focus on more social services. My own view is what's needed is a fresh approach that focuses on three areas: better prevention, better treatment, and better and tougher enforcement. Real success is going to require that all three work in tandem. When it comes to preventing addiction, any discussion has to include how these drugs are prescribed in the first place. In Oregon last week, I discussed with my constituents what I call the prescription pendulum, where doctors were once criticized for not treating pain aggressively enough. Today, they are being criticized for prescribing too many opioids to manage pain. So one of our challenges is to have policies that start getting that balance right. The Centers for Disease Control and Prevention is trying to break new ground with their guidelines for prescribing opioids. Along with better prescribing practices, there need to be more responsible marketing practices by opioid manufacturers. And I'm very pleased that we're joined today by David Hart. He's with the Oregon Attorney General's office. He's got background in both health care and law enforcement, and I think we're all going to benefit from Mr. Hart's considerable experience in this area. I'm also very troubled about the influence the manufacturers have on medical prescribing practices. I've sent an inquiry to Secretary Burwell to ensure that any potential conflicts of interest have been properly disclosed for members of government panels who are evaluating the Centers for Disease Control guidelines as a result of funding they receive from drug manufacturers. Doctors ought to have the best information on prescribing these powerful drugs without undue influence from the companies that manufacture them. In my view, a key piece of the puzzle has got to be more prompt and more effective treatment of those who are dealing with an addiction to opioids. A prerequisite for any lasting solution needs to include improving access to addiction treatment and mental health services, and that's especially important for rural and underserved communities. It's no coincidence these areas have some of the highest rates of abuse and overdose in the country. Mental health and treatment for addiction have also gotten short shrift for far too long, and it's time for changes here as well. For example, the Finance Committee could be taking a look at what's called the IMD exclusion, an out-of-date policy from the 1960s that says services like rehab or some emergency mental health stays in an inpatient setting cannot be covered by Medicaid. That's a big policy change. I believe it ought to happen, but I also think we're going to have to be acutely aware that vast sums that would be needed for these services would be a unique challenge. So the Congress has some tough choices to make if we're really going to solve this crisis. If prevention and treatment aren't addressed up front, the costs will be even higher. Pregnant mothers giving birth to opioid-dependent babies, EMTs and emergency rooms dealing with overdose calls every night, county jails taking the place of needed substance abuse treatment, able-bodied adults in the streets instead of working in a family wage job. America's tax dollars should be spent more wisely, and the Finance Committee's got an opportunity to find the right mix. I'm going to close by saying that I believe we already have an opportunity in this committee, in a bipartisan way, to start the reforms that are needed in this area. Our committee has been working for some time on a bipartisan proposal to get parents and kin care providers the kind of help they need to keep children safely out of foster care when addiction strikes a family member. A parent's drug addiction is becoming a growing reason for removing children from their homes and placing them in foster care. A recent Reuters investigation found on average a baby is born opioid dependent every 19 minutes. Using hospital records, the reporters found that there were more than 27,000 drug-dependent babies born in 2013. Many of these babies are going to enter the foster care system. In fact, as the committee will hear from Dr. Young, infants made up the largest group of children placed in out-of-home care in 2014. And growth in the share of infants entering care is a trend that has been increasing consistently over the past several years. Protecting these babies and their siblings is, in my view, going to require getting better help and treatment for the moms and dads that are suffering these afflictions. The chairman and I have been engaged in a very active effort to address these daunting challenges. We've been calling it the Family First Act, and it would help prevent unnecessary foster care stays through programs like evidence-based substance abuse treatment, reducing unnecessary congregate care stays, and putting in place stronger protections so that kids in foster care are safe. It's about making sure the system works better for the children. And I thank Chairman Hatch and all my colleagues on both sides of the aisle because I hope we can pursue these reforms soon. Finally, I spent last week getting about every corner of my state, from Medford to Eugene to Portland. I was in Eastern Oregon and Central Oregon. The message, whenever anybody asked about opioids, was clear. This epidemic is carving a path of destruction through communities in every corner of America. Oregon has the dubious distinction of ranking 4th worst for abuse and misuse of opioids in the nation. In my home state, citizens are not going to accept being 4th worst. And I know from talking with my colleagues, we've got Republicans, Democrats here, that every state is dealing with this crisis. Finally, one story of the many I heard was especially devastating, and it illustrates how dramatically this opioid crisis has unfolded across the country. I spoke with a parent who told me about high school athletes struggling with addiction to these medicines. When I went to school on a basketball scholarship, dreaming of playing in the NBA, there was never any talk in the locker room about opioids. Now the next generation of young people are getting swept up in a crisis beyond their control. So I thank all of our witnesses. I think we're going to have a good panel. There are colleagues on the Democratic side, there are colleagues on the Republican side that want to work constructively on these issues. And finally, special thanks to David Hart. It's a long trek to come and testify, but he has expertise on the healthcare side and on the enforcement side, and we welcome all three.